Good afternoon, guys. I hope we're all sparkly. As you can see, I'm a bit sparkly today. I've just done a workout, and rather than subject you to my offensive pagan Viking t-shirts, I thought I'd better put a work shirt on. The more I learn about the body, the more I appreciate the need for simplicity. Because the body is incredibly complicated. And we think we're clever. We're not clever. We overcomplicate things. The body has a way of working things out, and our brains mess it all up. More is better. More is always better. But in order to establish balance, and that's essentially what the body wants to achieve, it wants to maintain a constant internal environment despite external changes. We mess things up. We need to realize and appreciate the need for contrast. So you have anabolic processes and conversely catabolic processes. You have the sympathetic nervous system, fight or flight, and the parasympathetic nervous system, rest, relaxation. They are not mutually exclusive, but you need an appreciation of the need for contrast to establish balance. Now let's talk about the anabolic hormones. Testosterone, dihydrotestosterone, estrogen. No, estrogen is not the female sex hormone. Estrogen is necessary for mood, libido, cognitive function, bone mineral density, cardiovascular health, fertility. Estrogen. We need estrogen. Can you have too much? Yes. Can you have too little? Yes. You need to be like Goldilocks. Have just enough. You actually want as higher estrogen as you can without having negative side effects from excess estrogen. Now, who has estrogenic side effects? Chunky monkeys. Now, the aromatase enzyme is located in numerous tissues. One of those tissues is the adiposity, fat, both visceral and peripheral. So even if you're thin, you may think you're healthy, but you're not necessarily. You need to have a look at your visceral fat. Now, we have an in-body 770 machine at the clinic, and that measures all sorts of parameters, including visceral fat. So that will be part of your new patient workup. And it's a central tool to monitor your state of health and your progress on testosterone replacement therapy. So, chunky monkeys, beware. You have a propensity to excess aromatization, so conversion of testosterone to estrogen. So what? I want estrogen. I now realize it's super healthy. Well, the HPG axis. Let's talk about the basics. The brain responds to both external and internal changes. It tells the hypothalamus, releases gonadotrophin releasing hormone, which tells the pituitary to release LH, which stimulates the Leydig cells of the testicles to produce testosterone, and FSH, the Sertoli cells, to produce sperm. It's more complicated than that. So that testosterone that you've just produced gets converted to DHT. It can be used as testosterone, and it gets converted by that aromatase enzyme to estradiol. Now, estradiol is the primary hormone that has a negative feedback to the hypothalamus and pituitary to tell the brain that you have enough estrogen. So, is there an optimal estrogen? Logically, knowing the natural workings of the body, yes, there must be, because estrogen feeds back to the hypothalamus and pituitary to tell the brain you have enough testosterone. So there must be an optimal estradiol. Get it? I hope you do. So, What are the negative symptoms of excess estradiol? Anxiety. That's the big one. So normalizing estradiol can release, or I can't remember the word is now, still a bit, resolve anxiety. But you also need estrogen for mood. So again, too much, bad, too little, bad. Just right. That's what you want, just right. What else? Water retention. Now, when you start testosterone replacement therapy, you will have a little bit of water retention. It's estrogen. No, it's not actually estrogen. It's aldosterone. So if you think about the steroid hormones, cholesterol converts to pregnenolone, which ultimately cascades down to cortisol. Remember the stress enzyme, the catabolic enzyme, aldosterone, and testosterone, the anabolic hormone. So aldosterone gets stimulated and you have some water retention. Now that tends to settle within the first few weeks, so it's not estrogen. When is it estrogen? Well, normally when your levels have built up, and then you will have water retention because of estradiol. Even when your levels are stable, if you have water retention and you control estradiol, that water retention will resolve. So I've heard rumors of people being prescribed diuretics to lessen water retention on testosterone replacement therapy. That is retarded. So always look to causation, address causation. A preventative model is far more progressive than a curative model. Makes sense, doesn't it? So, estrogen. You should never block estrogen. You should never block estrogen. We've discussed this. So, should you control estrogen? In principle, you shouldn't need to control estrogen. In practice, unfortunately, in some people, you do. I don't need estrogen control. I'm fit, healthy. Body fat's a bit high right now. It's about 16%, which is a bit shocking, actually. But I'm almost a chunky monkey, but I can still do the pec dance, so I'm all right. But I'm losing that weight now. How do you do that? Primarily diet and exercise. But lockdown, I've become less disciplined because the gym's not open, and so my routines come out of whack. And to my best will and intention, I've not been as active as I normally am. So I've become a little bit of a chunky monkey, 16% body fat, but it's going. So, how should you control estrogen? We've just said it, lose weight. So if you remove one of the areas that causes estrogen, and that's the adipose tissue, you will lower your natural estrogen. Now surely it's protective, surely. Now let's consider nature. Do you find chunky monkeys in nature? No, because they get killed or starve. So prey, fat prey get picked off first by the predators. Fat predators can't catch the prey. Get it? Honestly, do you get it now? So in nature, you don't have chunky monkeys. Now there's something very wrong with our model. We're lazy. We don't have to survive, so we're faced with choices and we make bad choices. Wake up. What's been happening overnight? Your anabolic processes have been working overtime to repair the damage done into the day, to prepare for tomorrow, the day. So, your testosterone level is at its highest in the morning. There is diurnal variation of testosterone levels, hence the reason why we test testosterone in the morning. before you've been active and lowered your testosterone. So we want a gauge of what your natural testosterone level is, not your testosterone level after you've just run a marathon. Okay? So, what also happens in the morning? That stress hormone cortisol spikes. So you've got high testosterone and high cortisol. What the hell do you want high testosterone and high cortisol for? I thought you said testosterone was anabolic and conversely cortisol was catabolic. What should you do when you wake up? What you should not do is walk to the fridge. What you should do is do some exercise. Fasted exercise. Why? Hunter-gatherer. What were you supposed to do back in the day? Me go find food. Go find some food. Don't walk 10 meters to the fridge. Oh, yeah, I'm done. So what are you doing? You are satisfying one of your primal needs, and that is food. So when you satisfy that, your metabolic processes start, and you're lazy. Oh dear. So I'm a big, massive fan of time-restricted eating. We're not allowed to call it intermittent fasting now. Time-restricted eating. Breakfast, the most important meal of the day. Breakfast, break, fast. That does not mean in the morning. That means after you've hunted, after you've gathered. So don't eat first thing in the morning, unless you're diabetic or something, for some medical reason you've got to. So why cortisol? Why testosterone? Well, testosterone, you want to be alpha dog. Cortisol, you want to be alert as well. So they work synergistically. These two hormones, an anabolic hormone and a catabolic hormone, work synergistically for the primary purpose of you getting out there, finding some food. What's left? Bit of nookie. Who doesn't love a bit of nookie? So, it makes sense. Does it not? I hope this doesn't sound like gobbledygook and what's he been smoking? Because it's common sense. I like common sense medicine. I like simplicity. I think we have the tendency to overcomplicate things, and it's crazy. Honestly, it's crazy. We have dogma, and you've only got to see that within the TRT community. Always prescribe an AI. Never prescribe an AI. So how else can you lower your estradiol apart from weight management? You have to consider the other organs where the aromatase enzyme is present. So brain, can't do much about that. Testicles, can't do much about that. Liver. Okay, so we often see guys who have fatty livers or medications, so they're stressing the liver, have an increased propensity to aromatization. What else stresses the liver? All that processed crap that you're sticking in your body. So, clean food, real food. I'm a massive proponent of low carb, high fat. Now that does not mean no carb, because I'm not a fan of ketogenic diets, because the old liver has a process called gluconeogenesis that makes sure you can produce some glucose from protein, because your old noggin likes some glucose and your muscles store glycogen. So you do need carbohydrates, but we have a propensity, I love the word propensity, to excess carbohydrates. Why? Well, it's farming, essentially. So how did we feed the masses? Mass farming, grains, oats, So that has unfortunately become quite predominant in our diets. And who doesn't love a sugar fix? Why do we love sugar fixes? dopamine. They cause a dopamine spike. And we love dopamine. Oh yeah, baby. We love dopamine. Dopamine is the pleasure chemical. So it seems logical to have some pleasure. Does it not? Because what is life about if it's not pleasure? It's about purpose. Ooh, did you think it was about pleasure? It's not about pleasure, it's about purpose. Finding purpose. Be the man. It is. But we should have a bit of pleasure and enjoyment along the way, because it makes our achievements, our goals that we should be setting, worthwhile. Let's all just sit on a rock. I quite like my Zen, but I was mistaken. I thought the passivity was an excuse. Not an excuse, but I thought that was the reason we shouldn't be striving for anything different or change. But I now realise that that's not the purpose of Zen. Zen is really to be fully engaged in the moment and not be too perturbed when something bad happens, and not be too elated when something good happens, but just keep moving forwards on this journey to enlightenment. Because no, I'm only playing. So, the principles that we should adhere to are simplicity, the need for contrast in order to establish balance. We should be living by these principles. We should not be more is better. What has more is better done? It's got you sat watching this bloody video of this dude in a car ranting and raving to his iPhone like a lunatic. So common sense. We should apply common sense to medicine. You should never block estrogen. You should never block estrogen. However, if you have gyno, obviously the selective estrogen receptor modulator, that can reverse gyno as long as it hasn't gone to the fibrous stage. So we do sometimes use tamoxifen in treating gynecomastia, but we need to do it short term, because tamoxifen can have a negative impact on IGF-1, insulin growth factor, and we want that. We want to grow. But you should never block estrogen. Should you control it? You should control it through weight reduction, not stressing the liver, not polluting the liver with alcohol. Should you ever use an aromatase inhibitor? You should never, ever use anastrozole. Anastrozole is poison. So, anastrozole competitively binds with the aromatase enzyme. It's hard to control. We are trying to have a nice ratio of testosterone to estrogen to DHT, and we want that ratio to be reasonably fixed. However, life isn't a constant, so there are natural fluctuations. So adding in anastrozole, oof, horrible stuff, and I don't know why people do it. It's really common. So examestane, if we have to ever use an aromatase inhibitor to control estrogen, we microdose examestane. What sort of dose do we use? Now, the examestane tablet comes as 25 milligrams, and it's a cancer drug, much like anastrozole. But we use it for the purpose of attaining a healthy testosterone to estrogen ratio, because we have seen that it actually improves not only the qualitative but also quantitative markers. So, what dose do we use? On average, if we need to use it, we use it's 25 milligram tablet. We've got a compounding pharmacy that does bespoke whatever dose I want. It's normally 1 milligram. So 25 milligram tablets, we're using 1 milligram. So it's nothing. It literally is just taking the edge off. Why are we taking the edge off? To optimize that ratio so people can feel good, so that they can do what they need to do to lose the weight, get rid of the risk factors and the causative factors that are causing this abnormal ratio, and then get my guys off of their aromatase inhibitor. So long term, we should just be on testosterone and HCG. HCG. Why HCG? HCG mimics luteinizing hormone, so maintaining intratesticular testosterone production. Say that fast 3 times. And also there are LH, which is in the brain. We have to go this ad nauseum, and we are optimizing testosterone levels with testosterone. Radical, maintaining function. So TRT should be maintaining function and HRT, hormone replacement therapy, not bog standard testosterone monotherapy when we know that it suppresses LH and FSH. Common sense medicine. I like common sense because I'm a bit common, and I don't have much sense. So please, let's not promote dogma. I'll put links to the medical literature in the description so that you can peruse it at your leisure and understand that you should always act in the best interest of the patient. Never adopt a one-size-fits-all methodology, because we are all unique, not special, unique.